See, it looks like people are still coming in, but I'm going to get started and people welcome as you join. My name is Kate O'Neill, and I really appreciate everyone being here tonight. I work at Vermonters for Criminal Justice Reform, or VCJR, and we are the organization that will be operating Vermont's first overdose prevention center. And we're co-hosting tonight's event with the city of Burlington to provide information about what overdose prevention centers are and give you the opportunity to ask questions. That opportunity does not end tonight. This is one of a series of ongoing community conversations. And tonight we're actually launching a survey that we hope you'll complete, and we hope you'll share it with your friends and neighbors, because we are committed to making this process transparent. And we want your thoughts and questions as we move forward. I know that I personally had a lot of thoughts and questions when I first heard about overdose prevention centers. I had some skepticism and I had a lot of misconceptions too. Mostly, I assumed they encouraged drug use, and as someone whose sister struggled for more than a decade with substance use disorder, that idea really scared me. But as I learned, and as you'll learn tonight, the opposite is true. Overdose prevention centers don't encourage drug use, but they do save lives while having a positive impact on the communities they're in. So I'm going to let our expert panelists share all of the data around that, as well as their personal experiences. And then we'll have a Q&A, and I'm really looking forward to your questions. This event is being recorded, and everyone who registered for the Zoom will receive a link to the recording, which will also be available on the city's website and on the Town Meeting TV YouTube channel. And there'll be links to those in the chat. There are 3 people on our panel tonight. My colleague, Jess Kirby, is the Director of Client Services at VCJR, and she'll be the Director of the OPC when it opens. She has decades of both personal and professional experience with substance use disorder and with harm reduction. Brandon Marshall is a professor at the Brown University School of Public Health and one of the country's leading researchers on substance use epidemiology, including overdose prevention centers. And Ashley Perry joins us from Providence, Rhode Island, where she's the Deputy Director of Project Weber Renew, which is Rhode Island's largest harm reduction and recovery organization. And she leads the country's first state-sanctioned overdose prevention center. Before we kick things off with our panel, though, Teresa Vazina from the city is going to provide an update on the status of our OPC project here in Burlington. Teresa, take it away.
Oh, hi. Thank you, Kate. Hello, everybody. So excited to have everybody here and be really this is our first really big community event. So we've been working on this project behind the scenes for, oh my goodness, over a year now. And so I came on to this role as the special assistant to Overdose Prevention Center implementation through the mayor's office in November of 2024. So it's been about a year. And through the last year, a tremendous amount of time and thought, planning, and preparation has really gone into meeting the requirements of Act 178 and the operating guidelines and all of these sort of behind the scenes things to get us to today. We've had a lot of other milestones along the way. We've written proposals and compliance plans that were approved by our city council unanimously, and we have received our contracts from the state health department, which allows us to really get going with the work now, and that just happened here in the last couple of days. So today is really a special day for us all to be able to be here and share our work with you, what we've done so far, and bring you into the fold. Like how can you all be involved, and also bring in our expert speakers so you can learn a little bit more too. We don't assume that everybody knows everything about OPCs or what they might be or how they might be helpful. And so we wanted to sort of kick off our community engagement with this educational webinar. And then, of course, an opportunity for you all to ask questions of our expert panelist. I just want to give a big shout out to VCJR, Vermonters for Criminal Justice Reform. Honestly, all of that work I was talking about over the last year absolutely could not have happened without them. VCJR is very brave. They stepped up. They stepped forward to be the OPC operator when the doors open, and they've been doing all of this work with us behind the scenes, just without a contract, right? And it's quite amazing. They're a small team of 3, but yet have been there the whole way alongside the city, getting us to where we're at today. So I just have to give a great big shout out and thank you to them, and glad that we're partners. And even though a lot of work has happened, I know sometimes we're like, well, what else is going on? And I just want to be clear that no decisions have been made yet about like where the OPC will be or what it will look like hours and those types of things. That hasn't been determined because what we began in mid-July is actively working on what we call the service assessment. The service assessment is a key part of our phased implementation plan, and it is also a requirement of the Vermont Health Department's OPC operating guidelines. The health department created an incredibly comprehensive set of rules and recommendations and guidelines to ensure that the OPC will be running on best practice. And they also learned from our friends at Rhode Island, Ashley's team over there at Project Weber Renew, On Point, Brandon and his team, and really did an incredible job developing this set of guidelines for us to use here in Vermont. And so the service assessment is one of those early deliverables. The service assessment also includes, of course, engagement with people who use drugs. We're in harm reduction here, and we must always have the voices of the people that we are going to serve first and foremost, helping us to design and develop programs and projects that are going to support them. And so that work is already underway. It began several weeks ago. We're really excited about that piece. But in addition to that piece, we also are going to be doing that broader sort of ongoing community engagement process. And that starts now, but it continues throughout the entire project. So you might get tired of us. So tonight is one of the first opportunities that you'll get to learn with us. And we're inviting you to be a part of this process. And right after this panel discussion, we will be launching our community survey. So stay tuned. I'll talk more about that at the end. So now I'm going to kick it over to Jess Kirby from Vermonters for Criminal Justice Reform.
Thanks, Teresa. Hi, everyone. I'm Jess Kirby. As Kate and Teresa have said, I am the Director of Client Services at VCJR. And I'm so excited. It's been my dream for a long time to help make OPC a reality in Vermont. And I'm so excited to be working with the city and with Project Weber Renew and Brenna Marshall, who's going to talk to us, and all kinds of people. A lot of people in Vermont have helped to, get us where we are today. And, I'm just really, really happy to be a part of it. A really big part of the reason why it's been my dream to help make OPC a reality is because I'm a person with lived experience with substance use disorder. I struggled with opioids and opioid use disorders since I was like about 12 and was, had dependence on opioids from the time I was like 16 or 17. I started using injection drugs at about 17 and struggled with that for many years. I've experienced, several overdoses in my life, and I have experienced feeling alone and like I have to hide, feeling less than, and ashamed and scared to die. I used to try to do things to make sure that I wouldn't die. A lot of people think people don't care about their lives. That is not, what I've seen from people. I know and care about a lot of people who use drugs. At VCJR, we have over 350 clients, all with substance use disorder, and all of them, are, here and are really at risk, and people are really afraid to die. I used to, if I was, we had landlines, then, and I would be like at my mom's house while she was at work, and I would take the phone and push talk so that there was a dial tone. So that my hope was that if I started to overdose, I could quickly dial 911. That was my thinking, so that somebody would come and save me. Another time, and I did this a lot, I'd be in a parking lot by myself and I would crack the door a little bit so it wasn't latched so that I could lean up against it while I used, so that if I overdose, I would fall out. And somebody would be able to find me. And that actually happened one time where I did fall out in the Staples parking lot, which is, in Burlington, not far from downtown. And somebody did find me, and I almost died. And it was really scary and really traumatic for me. And I don't want people to have to do things like that. I don't want people that I care about to have to be in alleys and in stairways and in public bathrooms and hiding from people. I think it's harmful in so many ways other than, people being at risk of death. And a lot of people talk about, public drug use, which is something an OPC will really help. And I think Brandon will talk more about that. But many more people than those who have publicly used drugs are hiding somewhere, are alone because they don't have other options, and are somewhere cold with wet socks, freezing, trying to get some relief, from serious, serious physical pain, from serious, emotional pain, from serious withdrawal, which, I don't think we talk about with enough, like, feeling behind it, that is awful when everybody here probably is sick. Most of us, if we have the flu really bad or something, we're going to stay home. Our loved ones are going to take care of us. We're going to buy medicine and, baby ourselves and get back until we feel better, and there are people in our community. We have over 300, well over that, people who are homeless in Burlington who have no warm bed to go sleep in when they feel like that, who feel like that every day when they're in withdrawal. And there's a lot of suffering happening. And in withdrawal is one of those ways. People are really, really sick. They feel terrible. It's absolutely a fight for survival. And it's a need that people have. And one of the reasons that I'm so excited to make OPC a reality for people is to relieve some of that suffering for people. Like, people are suffering every day. I hear people say people don't want treatment, they don't want services, they don't want to connect. And what I found for myself and for tons and tons of people, most people, is that is not true. We cannot meet the need in Vermont of how many people need treatment, even close. Every single person I work with has been to treatment, has been to IOP, has been on methadone or buprenorphine, has been to residential treatment many, many times. Our systems are overstressed and overworked, and people are really struggling more than ever. They are really hard to access. It takes multiple phone calls. It takes appointments that you have to make. It takes buses that cost money. It takes, keeping your motivation up day after day to keep this stuff going. It's really hard. We need a way to keep people safe, to help people not be at such risk of dying every single day. I reversed 2 overdoses in the past 10 days that was really traumatic and sad. I've reversed many overdoses, but these ones were particularly severe and serious. And all I could think the whole time, while I'm by myself on my knees in the pouring rain, calling 911 and giving CPR, is this could be so different. And talking to Ashley and people at Weber Renew and hearing how it can happen in such a therapeutic way, both for the staff responding and the person experiencing the overdose, is just something that I want for people so badly, for my coworkers, for myself, and for the people that are really at risk, and who are overdosing and being this close to dying, by themselves. And it's like by the, grace every time that people get found, and some people don't, a lot of people don't, and we've lost way, way too many people. And so I just really want to, drive home to people um how hard it really is for people, that it is not as easy as you think for people to make change. We don't have the housing infrastructure, the treatment infrastructure. People are super disconnected. People are defeated from, putting everything they have into things and having relapses, and again, feeling full of shame and full of like, I'm not good enough. And people think that I manipulated and all these things. And substance use disorder is chronic and relapsing, and people are going to have periods of use and periods of non-use. And we need to have options for people where they can be inside. You don't have to walk around in wet socks and be behind a dumpster in an alley trying to find some relief. We care about you. We want you to be okay. We want you to be inside. And I can guarantee, I know because this was true for me and is true for people, thousands of people across the country, that, this is ultimate harm reduction and meeting people where they are. These are the exact people that people will be going to, yes, safely consume drugs and make phone calls to treatment. That is definitely going to happen, get treatment for their wound, like bringing people in and taking care of that need. And it opens the door now to like, okay, it's a huge barrier to people, completing other things they need to complete and getting treatment for that wound, and getting an appointment with a specialist and seeing a nurse, and getting a bus pass with a case manager so that they can start going to the clinic. And this is the like absolute best way to meet people where they are and do all of that in one place. So I'm really excited about it. It's something our community desperately needs. It's just the absolute ultimate way of meeting people where they are, letting people know who have not felt cared about in a really long time that that their lives are valuable, and that we want you to be here with us where you're safe, and we're going to help you stay safe. So, I want my kids to know that. I'm a mom. I want my kids to know that this is an OPC. We take care of people who are struggling in our community, and this is one of the ways that we do that. So I am so excited that there's an option like this that will help keep people alive and also benefit our community greatly in so many other ways. And so, there's only positives that can come out of this. So I'm really excited. And I really appreciate you guys listening to a little bit of my story. And I'm super excited for you to hear from Brandon and Marshall too. Or Brandon and Marshall. Brandon and Ashley. Thanks, everyone.
Thank you, Jess. I think I'm up next. Is that right, Teresa? Awesome. Okay.
Yes, thank you, Brandon.
We're going to get to questions after 2 more presentations. So feel free to use the Q&A button, which should be at the bottom of the Zoom screen, and we'll get to those questions. And those that we don't get to, I think will appear on a website with answers later. Is that right, Teresa, as well? So we'll do our best to get to those in a moment. And it's such an honor to be here with all of you. I, of course, being an academic, have slides. So I will try to get through this quickly and then hand it over to Ashley, who's going to talk about what this actually looks like in Providence here in Rhode Island. But as Teresa mentioned, I've been doing research around OPCs for, gosh, more than a decade now, first in Vancouver, Canada, and now here in Rhode Island. So I'm going to talk just for 10 minutes or so on what the research shows, the work that we're actively doing in New York City and Providence, and then pass it over to Ashley. So just so we're all on the same page this evening, I wanted to start with answering the question what OPCs are. They are overdose prevention centers, or evidence-based public health programs where trained personnel monitor participants for signs of overdose and intervene to save lives. But I really want to highlight that at the end of the day, OPCs are about connection. They provide, as you'll see in a moment, a suite of other services, often medical care, support services, and referrals to treatment programs, or sometimes co-location of treatment in the same building. These are actually not new interventions globally at all. The first were implemented in Switzerland in the 1980s. There's now more than 200 OPCs operating in more than 14 countries, but they are fairly new in the US. And so I think we're doing a lot of learning and education about what they're like here and what they will be like in other jurisdictions that are considering implementing them. They have gone by different names over the years. In other countries, you might hear the term supervised consumption facility. Drug consumption room is more common in Europe. We're going to use the term OPC, or Overdose Prevention Center, today. So, as I mentioned, a lot of other services are offered at an OPC. Typically, they might function as a drop-in center. They might have case management services available. Often they function like a syringe service program too, so people can access supplies to keep themselves safe and to prevent the transmission of infectious diseases like hepatitis C and HIV. They offer, as you'll hear from Ashley, a suite of clinical and health services as well. And part of the OPC is the consumption room itself that might be booths or inhalation rooms. I have some photos to show you in a moment. And then lots of other services, showers, referrals, or on-site access to substance use disorder treatment, referrals to housing, employment services, etc. So this is a photo of the consumption room of the first city-authorized OPC that opened in New York City in November 2021 by an organization known as On Point. There are 2 OPCs in Manhattan, one in Washington Heights and one in East Harlem. So you can see a few things in this picture. There's sterile use supplies in the foreground. The booths are in the background. And the trained person, the overdose prevention specialist, is monitoring people and is intervening if they experience overdose symptoms. They may often provide oxygen or naloxone or Narcan to revive particularly opioid overdoses. This is a fixed site OPC. It's a standalone building. And Ashley will talk about what the Providence OPC looks like, which in some ways is similar, a standalone building. But I do want to highlight that in other countries, you see them implemented in different ways as well. These are 2 pictures of OPCs in Canada. One is in my hometown, actually, of Kelowna, British Columbia, which is about 80,000 people. It's a RV, or converted RV, with the booths in the foreground and space to provide other clinical services as well that then can be moved and can provide services throughout this town. In other countries, as in Canada, they can also be implemented in health clinics. This is one integrated into a day program for people living with HIV. In France and other countries, you might also come across OPCs in an emergency room or a hospital setting as well. Most OPCs around the world are in large cities, New York City, Vancouver, Sydney, Australia, but they have been implemented in very rural places. This is an example of a mobile OPC that is operating in Grand Prairie, Alberta, which is about 500 miles south of the Arctic Circle in northern Alberta. It's been operating for some time. This town has one of the highest overdose rates in the province of Alberta, and so it's very busy. Even in a rural setting like this, they have thousands and thousands of visits, serving more than 400 people, and have intervened on more than 400 overdoses over this time period with no deaths. And that's really important. These facilities demonstrate time and time again that overdoses are preventable. Deaths are unnecessary when they can be treated effectively in places like OPCs. So I want to move down to the research. There's been a lot of research done, hundreds of studies over many decades, but I'll just highlight a few key findings that our team has led and others. The first question I want to walk through is, do OPCs reduce community overdose rates? So we were able to answer that question in a study we published in The Lancet in 2011. I'll just walk you through the results really quickly, and I'm happy to answer more questions during the Q&A. Essentially, very quickly, we looked at where overdoses were occurring in the city of Vancouver, both in the neighborhood around the OPC, that's the column saying less than 500 meters from the OPC, and then we looked at overdose rates in the rest of the city of Vancouver, both before the OPC opened, pre-OPC, and after the OPC opened, post-OPC. And what we found was a 35% reduction in overdose mortality rates after the OPC opened, compared to only a 9% reduction in the city of Vancouver overall. For those that are more visually oriented, this is what the data looks like. This is the neighborhood I was talking about. It's called the Downtown East Side neighborhood of Vancouver. The location of the OPC is shown in the red star. And the darker the color here, the higher the overdose mortality rate in that city block before the OPC opened in 2003. And we actually found reductions in block by block overdose mortality rate in every single city block in this neighborhood after the OPC opened, which is shown on the right-hand side of the slide. So I want to get to another research question that Jess alluded to. How do OPCs operate and help people move along the continuum of care? Do they provide a pathway for folks to enter into treatment? And the answer to that research question is yes. This is a study that was published by a colleague of mine actually in 2011. She followed people for 2 years after they started using the OPC in Vancouver. When they first started using the OPC, there were about 600 people that were not accessing any kind of addiction treatment when they first started using the facility. And over the 2 years of follow-up, more than 40% of people started engaging in some kind of addiction treatment program, which was a much higher uptake of treatment than we had been observing previously in this setting. She then built some of these statistical models, which looked at what are the factors that predicted more uptake of treatment. And anything on the right-hand side of that dashed vertical line was a positive force in terms of helping people access treatment. So regularly attending the OPC predicted uptake of treatment, and also contact with peer counselors that work at the OPC. The more contact folks had with people that work in the facility, the more likely they were to enter into treatment. And also, as we might expect, history of treatment was also a significant predictor of entering into treatment over this 2-year time period. This is the last study I have to show you on the individual health outcomes associated with using an OPC. This is a really nice research study that comes from France. It looks at the effect of what they call drug consumption rooms on a lot of health outcomes. Non-fatal overdoses, abscesses, and emergency department visits were their main focus. And they followed people for 12 months. They compared people who were using an OPC to people who were using syringe service programs in other cities in France. And what they found was that people who used the OPC had a 67% reduction in non-fatal overdose rates, a 79% reduction in abscesses and other kinds of skin and soft tissue infections, and a reduction in ED visits by almost 60%. And that was all compared to people who were using other harm reduction services. So that really shows the added health value of accessing OPC services over and on top of other kinds of harm reduction programs. So I want to finish now by talking about what impact OPCs have on the neighborhoods in which they're located. And I'm going to start with an old study, and then I'm actually going to show you some of the first people to see some of the work that we've been doing in New York City, which hopefully you find it as exciting as I do. Okay, so this is the old study from 2004. This looked at measures of drug-related litter and public drug use in the city of Vancouver before and after the OPC opened. The opening of the OPC is shown by the vertical dashed line, and these researchers essentially had students and research assistants systematically canvass these neighborhoods before and after the OPC opened to look for publicly discarded syringes, public drug use, and injection-related litter. And what you can see is significant reductions in all of those outcomes after the OPC opened that were correlated with an increased use of the facility, which is shown in the top left part of the slide. And this effect, this reduction in drug-related litter and public drug use, remained even after accounting for other things that drive public drug use, like weather and policing patterns. So really showing that immediate, sustained reduction in public drug use as you offer a facility where people can use inside safely, that results in reduced people using in public outdoors. Okay, so I'm going to show you now some of the work that is actually still under review. You're some of the first folks that are seeing these results from our work in New York City. So we've been looking in New York City at some other measures, some other neighborhood measures before and after the 2 OPCs opened. So what you see here in this study, we actually looked at anonymized credit card data, so transactions in businesses around each of the 2 OPCs. That's shown by the blue line, and we compared that to credit card transactions in neighborhoods in New York City that are most similar to these neighborhoods. That's shown in the orange line. And what we found, and the opening of the OPC is shown again by that vertical dashed line. So what we found, you can see really no impact at all of the OPC on these consumer spending patterns. It really tracks the other comparison neighborhoods, the orange line, right? You're not seeing any evidence that the opening of the OPC is impacting commercial activity in those neighborhoods. The horizontal gray line is the average consumer spending in these businesses in New York City overall. We were also able to look at foot traffic. So this was something one of our colleagues came up with, Bennett Allen. There are businesses and companies that track cell phones as you enter and exit businesses. It anonymously pings that activity. Kind of interesting. I did not realize this happens. But we were able to use that anonymized cellular data as a proxy for foot traffic in these neighborhoods. And we were interested in seeing, did the OPCs impact any foot traffic? And what we found again was no. In the neighborhoods with the OPCs, the blue line, the patterns are really very similar to what we saw in the comparison neighborhoods, which are shown in orange. In both neighborhoods, we saw increases in foot traffic, and that's because these OPCs opened in the depths of the Omicron wave in November 2021. So there was a lot of restrictions on mobility in New York City in that time that were lifted in early 2022. And that explains the increases in foot traffic we're seeing overall in these neighborhoods and in the rest of the city of New York. And then finally, we were also able to look at residential rental prices. So these are average rents in both neighborhoods, East Harlem and Washington Heights, so thousands of dollars here. And again, what you can see is that the rental prices really are tracking very closely to the comparison neighborhoods. There's some small difference in Washington Heights, but that was not statistically significant. So again, suggesting that opening an OPC is really having no impact at all on residential rental prices in these 2 locations. Okay, so finally, before I hand it over to Ashley, Teresa mentioned a community survey that the city of Burlington is doing. We actually were able to do something similar before the OPC opened here in Providence, and I wanted to share those results for you. We surveyed 125 people who lived or worked around the OPC where it ended up opening in a neighborhood called South Providence. And we asked people what they thought of the OPC. Were they supportive of it opening in their neighborhood? And we found that 3 and 4 participants, about 74%, supported or strongly supported an OPC opening in their neighborhood. And we hypothesized that the high acceptability there was really attributable to the education that Project Weber New had been doing, that city councilors had been doing, events like this, raising public awareness that make people aware of the goal of this program, the public health goals, and some of the research that's been done in other settings demonstrating their effectiveness. Okay, so that's all I have. I want to thank the wonderful staff I have, our study participants who are just incredible. The research is funded by the National Institutes of Health, so we're very grateful for that federal funding. And then I wanted to highlight as well, our research and other research is available at opcinfo.org. That link will be available in the chat. It's a great research hub for all things OPC. And you're also welcome to contact me via email as well after the panel. So that's all I have, Teresa. I think I'm going to hand it over to Ashley.
Thank you.
Thank you so much, Brandon. So good evening, everybody. My name is Ashley Perry, and I currently serve as the Deputy Director at Project Weber New. And in this role, I also direct the country's first and only state-sanctioned overdose prevention center. To tell you all a little bit about our organization, Project Weber New is actually the merger of two organizations, Project Weber and Project Renew. Project Weber was founded 15 years ago by a male sex worker named Rich Holcomb, who had recently been diagnosed with HIV and had lost a friend, who was also a male sex worker who was tragically murdered on Christmas Eve. So our organization is named after Roy Weber. His death prompted Rich to create Project Weber to solely serve male sex workers. That was a population that, although was at huge risk at the time for contracting HIV and experiencing violence, they often went unseen and felt invisible. Project Weber Renew was created 18 years ago by our now executive director, Colleen Daly and Doy, whom at the time was working in social services and saw that there was a huge population of female sex workers who were really underserved and were constantly coming in and out of carceral systems. That program really started as a diversion program, working very closely with local law enforcement to divert arrests in the Pawtucket, Rhode Island community. So now, almost 10 years ago, the two organizations merged, increasing their reach, and today we have become Rhode Island's largest harm reduction and recovery organization. What I am most proud of is that our organization is a peer-led organization, which means that many of our staff mirror or have some of the same experiences of the people that we serve. That may mean experiencing homelessness, incarceration, past drug use, and/or sex work. Myself, I lead through my own lived experience. And in fact, the thing that I am most proud of over the years that has come to be is that over a dozen of our staffers are actually former clients. So we have two brick and mortar sites, one in the capital city of Providence and another one in Pawtucket. We have a huge, robust outreach program with 4 outreach vans spanning across 10 cities in our state, in addition to 1 stationary van in Kennedy Plaza, which is our state's main transportation hub. We offer a very large range of services that could be just serving an unhoused individual's basic needs, to case management, HIV and Hep C counseling and testing, recovery support services, both through peer coaching and direct connections to recovery housing. We host about 9 weekly support groups that range from peer support groups to holistic healing and so much more. So about 10 months ago, we moved our Providence location to expand our services, and there opened up the country's first and only state-sanctioned overdose prevention center, also known as a safe consumption site, as well as adding clinical care on site and adding additional resources inside of our drop-in centers, such as drug checking, showers, laundry, and a food bank. So in the last year, through all of our programs, we have served 7,334 unique individuals across 22,915 encounters. We have distributed over 17,000 doses of life-saving naloxone. But the biggest thing that we really do supply people with overall is basic needs. And mostly that is just food and water. And within our over 22,000 encounters that we have made in the past year, we gave out basic needs on over 19,000 of them. We have directly placed and paid for 18,000 people into recovery housing and paying for a total of 7,000 weeks over the past 2 years, which is huge. I'm incredibly proud of our very robust recovery program. Oftentimes, folks don't think about the real barriers that people face going into recovery. And one of the barriers that we have here in our state is not only is there not enough space and things like residential treatment where people would go after a detox, but people oftentimes, these spaces are not available to them without money when they need it. In addition to that, in our state, we have a lot of rules around being in recovery housing. Like people have to supply their own food, they have to supply their own blankets, and they have to also do community service hours to be part of these programs. So we have really worked over the years to really fill in those gaps. So when people go into recovery housing, we give them gift cards for food. We link them to both peer recovery specialists and clinical services. We really want to wrap around them and give them all of the wraparound services. But what also makes our recovery housing program different from other programs that we have here in our state is that we really go about it in a very harm reduction focused way. So there is never too many times where somebody could access these services. I know through my own recovery journey that you never know when it's going to be somebody's time to kind of get it right. And that's what we really want to show with all of our programs. So currently we have 645 individuals enrolled in our Overdose Prevention Center program. So just under 10% of the total number of people we serve annually throughout all of our programs, which is a very similar percentage to other harm reduction organizations with wraparound services also operating overdose prevention centers. So essentially not all 7,000 of our clients are coming to our overdose prevention center, just a very small portion of them. At our overdose prevention center, we have capacity to serve 16 people at a time, with our 2 inhalation rooms and 8 booths. Between those 645 individuals accessing the overdose prevention center, they have made just about 6,000 visits, which is great because we know that people are both coming back, but they are also making safer decisions around their drug use, which is really the goal with an overdose prevention center. About 90% of our participants state that they would be using alone if they were not at the overdose prevention center, and almost 80% report that they would be using in a public space like a public restroom or a park. And most importantly, we have currently performed 154 life-saving interventions. We added clinical services at the same time as opening up the Overdose Prevention Center. We are operating those services through our clinical partners at VICTA, which is a local methadone clinic. Through that partnership, we have 1 full-time nurse, 1 full-time clinician, and 3 part-time doctors directly on site. They provide a range of services from urgent wound care to prescribing medicated assisted treatment. What is so great about this mini clinic is that it is also really operated in a very harm reduction focused way of meeting people where they are at. So people don't even need an appointment to come in. And we are already finding that people are 70% more likely to return to care at the satellite site versus VICTA's main site. And I will say that so much of this amazing work is really due to both our amazing staff and the community support that they have like helped build and foster throughout the years. We take an immense amount of pride in being good neighbors. Our spaces are not just spaces for our participants, but also for our neighborhood. We have hosted many events in our space, from neighborhood association meetings to memorial services. We host a food bank twice a week that we know many of our neighbors rely on. Our food bank specifically has made a huge impact on battling stigma within our own community. When you show up to our food bank, it is almost completely participant run, which means that our clients are the ones distributing and packing food for individuals. We are unique that we operate directly across from our state's largest hospital, so we are able to work very closely with their groundskeepers and their securities to keep our neighborhood safe and clean. That partnership has really been amazing because it has allowed us to build trust with one another and has led us to having really more robust relationship where the hospital is now making direct referrals to us, which we really want. And with all of that, I am just incredibly honored to be here with you all tonight while we are discussing the reality of about what having an overdose prevention center in Burlington could look like. And I will just say, like, from my heart, that I have been in this work for almost 10 years, and I'm just incredibly proud and humbled to finally be part of this really very small, unfortunately, movement to provide people who use drugs with the healthcare that they really deserve. So thank you, and I look forward to taking your questions.
Thank you so much, Ashley. Once again, I'm continuously learning, and that was amazing. I'm so excited to hear about what you're doing. And thank you, Brandon, and thank you, Jess. We have a bunch of great questions here, and I'm going to start with some of the ones that I mean, I might even be able to answer some of these. Is an OPC similar to a safe injection site? The answer is yes, the terms are synonymous. But I guess maybe, Ashley, can you talk a little bit more about that, how it's not just safe injection?
Yeah, for sure. So our overdose data here in Rhode Island is showing that most people who are overdosing are either using multiple substances or are definitely using stimulants, things like cocaine, methamphetamine when they are overdosing. We know that we have a very bad tainted drug supply here in the United States, and we know that people, any drug that you use, any drug that you consume, you could possibly overdose from. So we want to make sure that we're including everybody in an overdose prevention center, not just people who inject.
Great, thank you. And next question was, how many folks have died from an OD in Vermont? I know last year it was 183, but Teresa, do you know like a larger number?
Yeah, so we saw that question coming in, and also we're going to drop in the link, the 2024 data brief from the health department. It goes through May of 2025. And this is saying that, it is, sorry, 183 was in 2024. And they have preliminary data for 2025. And there's a link that you can go to, the opioid overdose dashboard, to kind of see more like current data points on that. And that will be in the link for y'all.
Great. Okay, let's see, what else do we have here? Teresa, this is another good one for you. What are the legal risks from a federal crime standpoint, both to the potential landowner of a potential site and to staff? And you're on mute, sorry.
Sorry, I couldn't get my mute button off. I think this really feeds into Act 178, which really speaks to the immunity that folks would have. So the immunity from Act 178 does include the landowners, the staff, the volunteers, the participants coming in. I can't go through all of the different nuances of that immunity, but we're going to drop in the link for Act 178. And if you want to go directly to Section C1, that's where the statute really starts to talk about what the immunities are for the different categories of people that are in that question, and also how it impacts staff and volunteers. And I think part of that question might have also been like about
I was going to ask the last part to Jess. How are the
Oh
drugs
yeah, I was
sourced?
going to say, isn't there another part about
Yep,
how the
yeah.
drugs? Okay, all right, just
Yeah.
making sure. Okay.
No, I got it. Thank you so much.
You're welcome.
Jess, I wanted to ask you two parts here. How are the drugs sourced? And someone else had asked, is it going to be possible to test drugs purity? I think was how it was phrased. Yeah, Robert asked, will
Sure.
people be able to test the purity?
Okay, thanks, Kate. So people will use drugs that they obtain elsewhere before they come to the site. And that it's like people are using drugs, that drugs are a part of what's going on in our community. So people use drugs, and people will obtain drugs somewhere else and bring them to the OPC. The drug supply, as Ashley was mentioning, is very contaminated. And so we absolutely will have drug checking at the site, and we're really excited about that. Currently, we have a partnership with Vermont Cares, that we'll be able to scale up a lot, where we do, once a week drug checking here now, and people are, coming all the time and they're worried about what's in their drug supply, and they're finding a lot of surprises. And so it's really important that people are able to check their drugs, and we will definitely have that at the OPC.
Great. And just a little follow-up. Somebody else asked that you said that they're hearing comments that, that the OPC will be supplying drugs. And I just want to reiterate that's absolutely not true. The OPC does not supply drugs. These are drugs people bring on their own to the OPC. And that same person is hearing comments that children will be allowed to use drugs at the OPC. Could you address that?
Yes. So the people who are using the OPC are people who are using drugs already, who are lacking a place to be able to use them. So people who are already using drugs, in our community will be able to use the site to, access many services and to have a safe place to consume drugs and have someone respond in the event of an overdose. Children will not be able to use the site. It is for people who are 18 and older. So there will be no children using drugs at the site, and it will be people who are using drugs already and really need a safe place to do that.
All right, thanks, Jess.
Yeah.
Brandon, I wanted to ask you if there is any evidence that an OPC attracts people from beyond the local community to come use the OPC or to access the services of the OPC. I don't know if this is something you research, but is there any evidence that OPCs attract people who use drugs from elsewhere?
Yeah, there has been a fair number of studies, Kate, that have looked at that question. And the answer is no. These are facilities that are typically located in places that already have a lot of need and a high rate of overdose happening. And so the vast majority of people who use an OPC are not traveling very far. They're walking, maybe taking transit. But it really is serving a population of people who are already in a community who are at tremendously high risk for overdose. I saw in the chat as well, I'll address this one, Eliza, and then I think Ashley might have had her hand up. Eliza asks, have you found an increase in over-policing in areas around OPCs? That was a great question, Eliza. We actually looked at that in New York City and found the opposite is true. After the OPCs opened in those neighborhoods, stop and frisk policing and drug-related arrests decreased significantly. And we think that's because, at least in New York City, the police department is actually a partner, really, with On Point. They're, instead of hassling people or arresting people, really trying to refer them to the OPC when it's appropriate. So we were not surprised entirely to see that reduction in some of that community level policing in those neighborhoods after the OPC opened. And that's really ideal, right? You want to do these things in a way that is done in partnership with other city and community stakeholders.
Thanks, Brandon. There's a lot of questions in here about what kinds of services are going to be at Burlington's OPC. And I know we don't have the answers to all of those questions, but I'm going to throw some of them your way, Jess. Will the OPC in Burlington have showers?
We are not sure yet because we don't know where it's going to be. We don't know the configuration of the space yet. So we don't know exactly, if showers will be there and exactly what, because it's going to depend a lot on, space configurations and the bathrooms are like and all that good stuff. But we do plan to have a lot of services for people who are homeless. Definitely food, definitely warm place to be, jackets, hats and gloves and a place where you can, get case management and peer support and medical care and all the things on a walk-in level, on a walk-in basis. So people will really be able to access a lot of pretty much anything they need. And we hope to be able to do things like showers and laundry.
Great. And Courtney had some great questions in here about treatment, and other people have been asking about staffing. So could you just sort of talk both about what, if any, treatment is going to be offered at the OPC, how it will be staffed, and what kind of staff there will be?
Sure. We currently have a partnership with the Johnson Health Center. They're awesome and do low barrier medical care for people with substance use disorders and co-occurring mental health disorders in Burlington. in concert with us, and we will definitely be offering people on-demand buprenorphine treatment, Sublocade, which is the buprenorphine injection, mental health treatment, all of those, wound care, all sorts of things. People need inhalers, they need, devices, all kinds of that stuff. So we will have a lot of built-in medical care and substance use disorder treatment, driving people to inpatient treatment, driving people to their first day at the Chinnen Clinic to start on methadone, helping people access buprenorphine in the moment, getting people connected with all kinds of outpatient substance use treatment services. And we're really going to do that when people ask for it right in the moment. So we're really excited about that. And, as a person who, has really needed harm reduction and treatment services in my life, I, know I would not be here today if it wasn't for my connection with harm reduction providers. It was actually Tom Dalton, who I was working with at the time. And really the only time that I went to like a syringe exchange was when I needed syringes. But during that time that I was there, he was getting to know me. He was caring about me. He wasn't, harassing me about my substance use and when I was ready to make change. He was just being warm, being open, getting to know me, and it made me feel safe. And when I had an overdose, when I had a wound, when I was really down and out and I had been waiting for treatment for a long time, that he's who I went to. I didn't go anywhere else. I went to, a harm reduction provider that had prioritized relationship with me over everything else, and my safety. And I know that will happen at the OPC. And that will connect a lot of people with treatment and recovery services, like Ashley was saying.
Thanks, Jess. And Ashley, you had your hand up before. I'm sorry, I didn't see it.
Oh, that's fine. I just wanted to make a point earlier about the drug checking question. So one of the things that we often don't think about is how late our response is always to fatal overdose data. Oftentimes we are not reacting to overdoses in proactive ways. We are being quite reactive to very old data. So most of the time when we see overdose data, it is about between 6 months and a year old. And with our ever-changing so quickly drug supply, it is very hard to keep up with that. So one of the real resources that we're seeing that the Overdose Prevention Center really plays is we are seeing how people are reacting to things in real time. We are seeing withdrawals from different drugs that weren't in the drug supply a month ago. So it is really such a valuable resource to our Department of Health and to our overdose data experts.
Great, that's such a good point. Thank you for clarifying that. All right, let's see. This is actually, we've got a bunch of questions in here about timing and location. So I'm gonna maybe send those to you, Teresa, and about the timeline. Do we have a sense when it will open, what's happening in that regard?
We actually don't, it's really hard to know when it's going to open. Like we said, we're really in the early planning and capacity building phases, and so many things hinge on the real estate market as well. But we really want to get, the input from this service assessment. We'll have preliminary data just in just several more weeks after the holidays. And I know that, and Jess can talk a little bit more on this, but part of the proposal was that we'd work with VCJR would work with a broker, and we'd create like a site acquisition plan and really walk through some different steps that have to happen before we can actually locate something. And so I think it's hard to really give an estimate, but in our proposal to the health department, we did hope that we would be looking at potential sites by early in 2026 and starting to have those conversations. And for folks that don't know this, the city council will also vote on the approval of a site as we bring different locations to them through our zoning and ordinance as well. So.
Great. And Jess or Teresa, what about hours of operation? The city looks at OD response data. Are we looking at the time of day that ODs happen? This question is from Sarah Russell. Do other OPCs operate 24/7? what's being discussed in Burlington? How will that be decided?
So a couple things. I'll let Ashley speak to their hours in a second, but I have a friend who works at On Point, and they have hours into a little bit of the early evening, at least as of a couple of months ago, but mainly daytime hours. And the hours at the OPC in Burlington will be, part having to do with funding, definitely in part having to do with what we learned from the participant surveys. We want to hear from people who are using drugs, and that's one of the questions, asking them about that. And yes, we'll be considering overdose data and when it makes sense for that. And so a lot is up in the air because we're doing this service assessment. We're trying to figure things out. We want to be hearing from the community and hearing from people who are using drugs really specifically on all these things and learning from Weber Renew. And Ashley, do you want to share a little about your hours in Rhode Island?
Yeah, so our current operating hours are 9 to 5. With our state legislation, we have to get both the location and the times approved by city council. And we really wanted to open during our normal business hours to start to really make sure we're getting all our ducks in a row and figuring things out, but would love to soon go back to our city council and expand some hours. As I talked about earlier, we are historically a sex worker organization, and I want to make time for specialized populations. But as of right now, that's just hard with having a 9 to 5 schedule.
Say one more thing, Kate, on that. When, we talk to people who use drugs every day, when we were doing the participant survey, people were coming out and they were talking about that question when they were doing the researchers, and they say, so many people think that it has to be like at night and that that's more important than the day even. And they were actually disagreeing and saying like, no, people are used to being out and about during the day. People wake up in the morning, they have withdrawal they need to use. People are out and about during the day. People are using drugs during the day. And also another really important factor is that, like we've said, we're connecting people with a lot of other services. We're doing a lot of other things there that we need things to be open in order to do. So I think, we're gonna, figure it out based on all of the things that we just talked about. And I think we would like to have some evening hours for sure. But, I think daytime hours are extremely important too, for all those reasons. And really make a lot of sense.
Yeah. Um, so coming back to sort of a staffing question, Jess, and then maybe Ashley, you could talk about this too, or maybe you could talk about it first. Like what kind of staff you have at the center, psychiatric medical, like who works there?
Yeah, so as I talked about earlier, we do have a clinical partnership that we have a full-time nurse, a full-time clinician, and 3 part-time doctors. But aside from that, we have a fully peer-led staff. So folks who are working in the Overdose Prevention Center and doing overdose reversals are all peer staff.
Great. And Jess, can you talk a little bit about what the staffing will be like, how we will staff the OPS in Burlington?
Sure. So there will be, just like at Weber Renew, there'll be overdose prevention specialists. Those will be the people that their primary roles are, in the consumption space, monitoring for overdose and responding for overdose. So there'll be several of those positions, and then there will be an OPC director, there will be case managers, there will be medical staff, there will be a lot of people that are direct service staff that are there to help people respond to what's going on, connect people to services, treatment services. So, people responding to overdose, and then supportive staff for case management and treatment and driving people places and, giving medical care and all those things.
Great. And one person asked if it costs any money to use the OPC, if you have to pay a fee.
No. Everything at our overdose prevention center is both free and confidential. And our overdose prevention center is hugely, mostly funded by our state and city opioid settlement dollars, and also funded by a few private foundations. So no tax dollars go to this project.
Yeah, and Jess, you can confirm that there would be no fee for using the OPC in Burlington, no need to have insurance or anything like that.
Nope, no fee.
Brandon, do you have any data about whether OPCs increase drug sales in the area around them?
Yeah, that's a great question, Kate. There is, I wish I could figure out, maybe Teresa, you could send the link to the audience. There was a study that was done a year and a half ago in New York City that looked at this issue. They evaluated drug-related arrests, violent and property crimes, and also 911 calls for both medical emergencies and other types of calls, nuisance calls, crime-related 911 calls, etc. And they found reductions in all of those measures of neighborhood disorder after the 2 OPCs were opened in Manhattan. So there's really no evidence at all that they increase drug-related activity in the areas in which they're located. In fact, most evidence points to the opposite, that they improve measures of crime and neighborhood disorder. Because you're offering a safe indoor environment, right? And so it really changes fundamentally, I think, the way that people move through and interact with their neighborhood when this can happen indoors in a safe location with peers available to provide services, support, referrals when needed. And so hopefully, Teresa, you can circulate that one paper that was done in New York City, and other studies in other countries have largely shown similar findings too.
Thanks, Brandon. And Jess, did you want to add anything to that?
I want to add one thing to the question before about staffing. So I should have said that, there will be one overdose prevention specialist at least, for every 4 people using the site. There's also, something called, the position right now is called like a responsible person in charge that will be supervising the staff that are monitoring overdose. And then there's positions above that, like the OPC director. So there's a lot of, hands on deck, prioritizing safety. There's going to be also, peer support services. And, we really value people with lived experience and peer services. And so I just wanted to make sure that I added those things too. And in terms of increasing drug sales in the surrounding area, I know that this is a hot topic that people really worry about. And, what I can say about that is that people who sell drugs, they don't need to go and frequent outside one place where people who might use drugs might be. There are other places that people, go who use drugs that they could frequent those places and sit outside. I have not seen that happen in any significant, meaningful way. Does it mean that there's never anybody outside, a treatment center or a harm reduction organization that exchanges drugs? Yes, of course there is. People who are using drugs often exchange drugs with friends, with partners. um, you know, uh, Sometimes even sell drugs in a more minor way as a way of surviving and a way of getting by. Those things happen. But in terms of something that we would picture more like in a movie where it's like, big drug dealers that are really dangerous coming and parking outside the OPC because it's the only way they can sell drugs, it's just not logical in terms of what really, goes on. People who sell drugs are typically in apartments. People, they don't need to go find people who use drugs because, those things happen really naturally. And it's not, there is a demand for drugs. So people don't need to go do that. And I just have not seen that in any really realistic or in any significant way that it really impacts a neighborhood. There might be drug using behaviors sometimes that happen, which, as Brandon has stated, is not something that we've seen an increase in with other OPCs. But I don't believe, and I don't think we have any evidence to support that, there will be a lot of high level drug dealing, right outside the OPC.
That's such a great point, Jess. And, for
Thanks.
what it's worth, and Ashley can speak to this, I bike by our OPC most days. It's actually on my way home between work and my house. And, I've not seen any discernible change really in the microenvironment right around the facility. We are, though, I should say, researching this actively right now. So we are currently systematically observing the neighborhood around the OPC and other neighborhoods in Providence to try to identify some of those changes, if they are present, that might not be picked up in some of the administrative data like 911 calls and drug-related arrests. So we are doing that work currently. We are still collecting the data, actually. So hopefully you can have me back at some time, Teresa, and we can have a look at it. So we are doing it, but from what I have seen, and I bike by most days, I've really not seen any difference at all. I don't know, Ashley, if you maybe have a different thought because you are there day in, day out. But
Yeah, so I would say that we definitely haven't had an issue with a bunch of drug dealers coming and surrounding our area. I think that was a big community concern that our community also had. And I would say too that something that is really just amazing about our space is that our participants really take ownership over our space. They know that it is for a lot of our people, it is the only place for them to go. And they do a lot to protect that space. Like I said earlier, if you come in on food bank day, they are distributing the food. If you come by and somebody is wearing a PWR work vest and they are sweeping outside, it is most likely one of our participants. And they work really hard to keep their space safe, and I'm incredibly proud of that.
So maybe a follow-up to that, Ashley, that you could talk about, in practice, and Jess, you could talk about, potentially what we would do in Burlington. An anonymous attendee asked, what can we do to make sure that the center not only saves lives, but also improves safety and cleanliness in the neighborhoods around them?
Yeah, I think that that's going to take a lot of communication, both from community members and VCJR. We have a very open line of communication with every stakeholder in our community, but also our community as a whole. Part of our process of opening up our overdose prevention center, we went door to door and knocked on people's doors. We gave them our phone numbers. We said, please call us if there is a problem. And it has really gained such a great community response. We are in a kind of very mixed area. So we have some of the state's largest hospitals next to us, but we also have a college and a high school down the street. We have a law firm and a spine center across the street from us. And almost all of those people have gotten super like involved in a lot of our volunteer opportunities. So tomorrow actually the law firm wants to volunteer to come both make sandwiches with us in the morning and then go out and do a community cleanup. But it really does take that open and honest conversations to make it happen, and if somebody needs to call anonymously, like we let them come however they need to come. But our response is always trying to problem solve and trying to fix whatever the issue may be.
I can respond a little too. I'll just say that, we absolutely plan on being a part of being a very big part of efforts to clean up syringes in the community. We'll be going out and doing that for sure. We want people to call us in those situations. Tom and I both have experience in the past where we had lines where people could call in former roles in syringe service programs where they would call and we would pick up every syringe in Burlington, not that long ago. And we actually really hope to be able to get back to that. We're gonna have a lot on our plate, but right from the beginning, we plan on playing a big role in syringe cleanup. We also care a lot about being good neighbors. Our clients really respect us, and they police each other and will say like, hey, don't do that here. They are here to help us. They do so much for us. We can't, throw our trash on the ground or be loud outside. Like that happens every day. And we're not afraid to go out and ask people like, hey guys, you're being really loud. We really, really need, to be good neighbors here. It's important for, what we're doing and to make sure that we can continue to stay here. And 99% of the time, people are always super respectful of that. They value our services, they value us, they feel cared about and by us, and so they want to give back in that way of like, okay, we're going to help, be good neighbors too. And in terms of, drug sales happening outside the clinic, I also want to say that, if that were happening in some significant way, in a really dangerous and significant way, we would absolutely be addressing that. If we knew somebody was doing that outside, we would be going out there and asking people not to, and we would find ways to manage that situation. So we plan on being very good neighbors. We plan on taking this seriously. We want this to be successful. We want it to benefit the community. We know that every time somebody uses in the OPC, that's one less time that somebody's potentially using in a public place. So that's a net gain 100% of the time. We know the syringe is being disposed of in a proper way. So it is just by nature absolutely going to be helping the community to have less public drug use and less syringes, improperly disposed of. So, and also people are struggling sometimes with the effects of the drugs. So people can have a place to, be in crisis and where they're not in a good place to be outside in the freezing cold and they need to be monitored because they're really sleepy or they are having effects that are louder and are upsetting to community members. This is going to be something that's going to benefit the community in many, many ways.
I just forgot to say earlier that something else that we just really value so much is just having an open door policy with anybody in our neighborhood, any stakeholders that we may have, and at any time, if anybody ever wanted to come tour the OPC, like we have an open door policy to really make that happen and make space for that. We know that this is a really new thing that can be exciting and scary all at the same time. I think a lot of folks don't know what to expect. And what was really ironic about that is the biggest feedback that we have gotten as people have toured the OPC is that they are so amazed of how clean and organized it is, um, which was just very interesting to me because it is somewhat of a medical facility, but people I don't think ever looked in it in that way. And I mean, if anybody here is ever in Rhode Island and wants to come see our OPC, you are more than welcome to.
Thanks, Ashley.
I have to just say something about the visit to Rhode Island because I got a chance to visit and it is incredible. The space there is just incredible. And Ash was talking about the folks outside with their vests, and I was outside waiting for my Uber, and someone in a little van said, "Do you need a ride, honey? Get in, I'll give you a ride." And they were so friendly. It was just so, it was awesome. So yeah, maybe we could get a van and go down together as a big group.
Thanks, Teresa. So we just have a few minutes left. And just to be clear, any question that's asked tonight and isn't answered tonight, we will answer and then we'll post the answers on the city's website. So I'm trying to get to all of them, but I can already tell we definitely won't be. So, but they will be answered. They will be on the city's website. You also can contact the city or you can contact VCJR directly. All of that contact info will be in the chat. But in the meantime, there's some questions in here about how people can help. So, are there going to be opportunities to volunteer? How can people support the OPC? What can they do to help make it happen? I was going to ask Jess that, but I don't know if she's here.
I'm here.
Oh, you are?
Sorry.
Okay, sorry.
Yeah, I'm here. How people can help right now, people can help by, being supportive, talking to friends and family and community members about what they've learned here, about why they think OPCs are important, supporting city council process, and being supportive in all those ways. We definitely want to find ways to utilize volunteers once we get set up and we're in a space and this is reality. And we're really excited about involving the community and having more events and finding ways for people to participate. But we can always use donations of winter gear. We can always use donations of snacks. And those kinds of things are always welcome. And we really appreciate everyone's support.
Ashley, do you have any other ideas in general when you were getting started, if there were things that you would have asked from the community or?
Yeah, I mean, our community is so lovely. They really came together to make this such a beautiful, welcoming space for people. So we had volunteers doing so many different things from making, bike locks for us outside of our facility to building a garden. Some people came in and volunteered and painted murals and just painted walls with us and helped us pop on doorknobs and assemble chairs. And it was really such a community effort to get us up and going. I know we felt so much pressure to really get it up at one point, and just the community really came together and surrounded us and really just helped us make it happen. So I'm sure there'll be so many opportunities down the line.
Great. And Jess, this is sort of not specifically about community support, but somebody asked if the OPC in Burlington has the support of our first responders. Is that one you could address?
I think like with everything, I think that, people individually have different ideas about that. I know the former Teresa might be able to speak to that more than me, honestly, 'cause she works with the city, but I know that the former fire chief was really supportive. And I know that I interact a lot with not a lot, but certainly many times with first responders in Burlington. They are so compassionate. Like last night, Teresa and I did a neighborhood meeting with the new fire chief, and I went up to him and told him, that we are so grateful and know how lucky we are that we have first responders in Burlington that are treating people with such compassion when they do respond to overdoses, and that we're really looking forward to helping relieve some of the burden on our first responders and not have to have so many of those calls, be utilizing EMS and ERs. And I would think that, people would be really excited to not have that system be so overburdened, which is very expensive. There are many other emergency calls. And so, we know that this will, decrease the need for that a lot. So.
Thanks, Jess. So I'm gonna, Teresa, I think you have possibly some things to add to that answer, and maybe then you can wrap us up and let people know how they can respond to the community survey. I personally want to thank everybody for coming tonight and encourage you to please fill out that survey, share it with your friends and neighbors, and also look for, if your question wasn't answered, look for it on the city website. Teresa?
Yeah. Oh my goodness. Wow. Wow. Thank you everybody for all of the speakers, and also all of the amazing, wonderful questions that came in. And there's so many more to be answered. I wanted to make sure, because we just have a few minutes left though, that we do tell you about our survey. So I am going to share my screen real quick here. So the what you're seeing here is the QR code that will bring you directly to the community survey. And also there's a link as well, which will be in the chat if you prefer to do it that way. But, as we continue this work, it is essential that we have everybody's voices involved. Everybody's voice matters. So this survey is a key part of our commitment to transparency and community input. We really want to hear from you. We want to hear your questions, your concerns, and your hopes for what the center can be for Burlington. It is live now. It is going to be open from now until December 15th. So we have lots of time for you to take it, share it, all of those things. And there'll be many more ways that we'll share this over the next 6 weeks with the community as well. It is available in 6 languages, so 5 additional languages: French, Spanish, Arabic, Swahili, and Nepali. And I'm working with the TCV crew from the city to make sure we get out to BIPOC communities, and with translators to help those folks be able to have their voices heard as well. I was in a meeting the other night and was reminded that, this is not just, this affects all communities, and sometimes they get forgotten, and we're not going to do that. So we're going to make sure we get out there. So if you know folks that, are not native English speaking, and they need something outside of these 5 languages, let me know. We'll figure it out. Okay. And, just your feedback it's really important to us in learning what the priorities of our communities are and what the needs are. It should take maybe about 10 minutes to do the survey. You can take that now. You can also, take it later, and please share it. Share it widely. We'd like to get as many respondents as possible. Again, it's a first event kicking this off, so you're going to probably get tired of the emails and the blasts coming through your listservs. And I just want to just give a giant thank you. I know there's lots of different things you could be doing on a Thursday evening, and to spend an hour and a half with us to learn about overdose prevention centers and what this work means, not only to the people who will use the center, but what can it mean for our community is just really amazing. And your commitment to learning and being a part of this is just amazing. So, I just thank you so much. And I will send an email out too, through the same sources and on our social, letting people know when the answers to these remaining questions are live up on the city website. So that way you don't have to kind of keep checking back, but you're welcome to peruse the Overdose Prevention Centers page. There's tons of information on there, some frequently asked questions, but also really goes deep into a service assessment and sort of what that means. And I do put regular updates on that page as well. You can sign up for the newsletter, all the things. This is going to be available for rewatching again on Town Meeting TV YouTube channel, on the city website. And since you're here, you'll also get a link to that in your email. And again, thank you so much. Your voice matters, and we're so thankful to do this work alongside all of you, and Brandon, Kate, Jess, Ashley, everybody. Thank you.
Yeah, a special thank you to Brandon and Ashley, not just for being here tonight, but for all the work you've done in the years before this. We are really standing on your shoulders, and we really appreciate it.
So
Thank you, everybody. Have a good night.
Thank you.
Good
take
night.
care.
Bye.
Bye-bye.
Good night.